RSV season, but Cook Children's Healthcare System says its ER and urgent care centers, well, they are busier than ever. Cook Children's Emergency Department in Fort Worth just saw 603 patients in 24 hours. That's about one patient every 2 minutes, and doesn't include its urgent care centers. I want to bring in our medical expert, Dr. David Winter from Baylor Scott White Health. Good morning, Dr. Winter.
Good morning, Tachara. Good to be with you.
Absolutely. What's the latest on RSV?
Well, as you said, there's still a lot of it out there, and the sickest kids are ones age 5 and less. Older kids tend to tolerate it well. Adults tolerate it well, unless you have chronic lung disease or heart disease. But the younger kids have the worst disease because their lungs are young, immature, and their chest muscles aren't as strong yet, so they have trouble with the secretions. Those build up, lead to bronchitis or pneumonia. Now, we don't have any vaccine for this, but good news, Pfizer has said they plan to have a vaccine out next year for RSV. Hopefully we'll see that next year.
And Dr. Winter, what are you seeing at your hospital?
We're not seeing a lot of kids. We don't have a lot of children in our hospital, but we're sending most of those to children's, and they're about 95% full, I'm told, right now.
In regards to vaccines, seems remarkable that a new vaccine can be developed in less than a year. How is that even possible?
Yeah, it's important to understand science has made great progress in the last decade or so. Right now, scientists can actually see the entire RNA and DNA of a virus. That's the blueprint for how it's made and how it replicates. When they can see that, they can find ways to block it entering our body or block it from replicating when it gets in our body. Couldn't do that years ago. That's why vaccines now can be made so rapidly and so effectively.
Okay, what about the flu vaccine? I know a lot of folks have been saying they wanted to get one. Have you gotten one yourself?
Yes, Tashara, I got mine a couple weeks ago. Mild sore arm for one day, that's all that I had. A lot of flus predicted this year, and I can tell you from last year's, patients of mine who have had a flu shot and get the flu have either no symptoms or very mild symptoms, 2 or 3 days, a little stuffiness, little muscle aches. Patients of mine who did not get a vaccine, they're very sick, 5, 6, 7 days at home. Some of those are hospitalized. So there's a big difference to me in folks who get a vaccine and folks who don't when they come in contact with influenza.
My goodness. Let's talk more about some common health issues. Twitching of the eyelids, that can be disturbing to a lot of folks. What is that all about, and what can be done to treat it?
Yeah, you may have had that, Tashara. I have myself. A little twitching of the eyelid is kind of distracting. It's more likely to happen if you're sleep deprived, if you're stressed, and if you had a lot of caffeine. That's the way actually to treat this. Get plenty of rest, cut back on the caffeine, and try to minimize your stress when you can. Exercise actually works for me. It's not usually a serious thing at all. It does not affect your vision. In some cases, it causes blepharospasm, a chronic spasm. That's a different condition entirely. That responds to Botox. But take care of yourself, relax, less stress, less twitching of the eyes.
Dr. Wynn, I feel like you were talking directly to me with that last one. Take care of yourself and just relax. Thank you so much for joining us.
You bet. Have a good weekend.
You as well.